Recently, I came across some alarming research findings on how frequently prediabetes and diabetes occur. On average, 1 in 3 people worldwide has prediabetes, and 1 in 10 has diabetes. What's worse, up to half of these individuals don't even realize they have a problem. Elevated blood glucose levels often don't produce any obvious signals at first, but over time, concerning symptoms begin to appear, and unfortunately, they're often dismissed. The longer we wait to take action, the more serious the health consequences can be. I'm not trying to be dramatic here, but the fact is that too much sugar circulating in our blood vessels can be called a silent killer. Wanting to draw attention to the scale of this issue, in today's presentation I'd like to highlight the key symptoms of high blood glucose. My hope is that this information will inspire at least some of you to pay closer attention to your own body and react at the right moment. I'll also briefly touch on the causes of elevated blood sugar. But first, let's look at the natural process involving glucose in the body. After each meal, blood sugar levels rise because the carbohydrates we eat break down into glucose, which then travels from the intestines into the bloodstream. This glucose serves as fuel for our cells and is used to meet their immediate needs. Problems start when there's an excess of glucose in the blood for too long, commonly referred to as hyperglycemia. This situation typically occurs when cells have trouble taking up sugar from the blood. On one hand, the cells begin to starve because they're not getting enough glucose. On the other, the high concentration of sugar starts damaging blood vessels. I'll discuss the consequences of such damage later. For now, let's move on to the specific symptoms that can indicate high blood sugar levels. The first sign might be more frequent urination than usual, or polyuria. If you've noticed that you're visiting the bathroom far more often lately, it might be your body's attempt to eliminate excess sugar. The kidneys try to flush out glucose via the urine, which increases urine production. Some people even get up multiple times at night for this reason. This excessive fluid loss can then lead to intense thirst, known as polydipsia. Drinking large amounts of water is a natural response to losing fluids and electrolytes. Of course, severe thirst can have many causes, such as high temperatures or physical activity, but in the case of hyperglycemia, it's an important piece of the puzzle. Another common symptom is headaches, which largely result from dehydration. Excess sugar in the system can also constrict and swell the blood vessels in the brain, intensifying the pain. At first it may be mild, but when blood glucose stays high for a while, the discomfort can become more severe. Another frequent sign is dry mouth. Aside from a rough, dry tongue and chapped lips, you might develop small ulcers or have difficulty chewing or speaking. It's worth remembering that in hyperglycemia, your salivary glands don't function properly and produce less saliva. If you feel constantly fatigued, even when you get enough sleep, it could also be a sign of high blood sugar. Although there's plenty of sugar floating around in your bloodstream, your cells can't absorb it and effectively end up starving. In response, your body may also be forced to produce large amounts of insulin, the hormone that pushes glucose into cells. But excess insulin can sharply lower blood sugar, leaving you with sudden hunger pangs or polyphagia. As a result, some people experience an uncontrollable appetite that even a big meal can't satisfy. When too much sugar remains in the bloodstream, it damages blood vessels in the brain and disrupts neurotransmitter function. Combined with dehydration, this can lead to concentration problems, memory issues, and mood swings, ranging from depression to inexplicable anger. Although the exact mechanisms behind these changes aren't fully understood yet, they've been observed in many people with hyperglycemia. Skin changes are also common when blood sugar is too high, itching, irritation, peeling skin, and darkening in areas like the neck, armpits, or groin. These issues stem from dysregulation of cells, such as fibroblasts, melanocytes, and keratinocytes. Over time, chronically high glucose can cause the skin to lose its elasticity. Men may experience erectile dysfunction. Studies indicate that erection problems can affect up to half of men with diabetes, mainly due to damage to blood vessels and nerves, as well as reduced release of nitric oxide, which is necessary for an erection. You should also know that excess sugar weakens the immune system, making you more susceptible to various infections, which can be both more severe and longer lasting. For example, people with diabetes frequently have urinary tract infections because sugar in the urine promotes the growth of harmful microorganisms. For the same reason, intimate area infections can appear, especially in women. Symptoms include burning, itching, and discharge. Additionally, high blood sugar slows wound healing due to impaired circulation, damage to the protective endothelial layer, and the development of inflammation. I want to emphasize that not all these symptoms will appear in everyone dealing with hyperglycemia or diabetes. The severity and type of symptoms can vary. Some show up during prediabetes, while others only become evident in advanced stages of the disease. That's why it's so important to listen to your body and pay attention to even the smallest changes. Ignoring your body's signals can lead to far more serious complications. One dangerous consequence is vision problems, where damage to the retina, known as diabetic retinopathy, can occur. In extreme cases, the retina may detach entirely, causing total vision loss. Another frequent issue is tingling or numbness in the hands and feet, caused by nerve fiber damage, which we call diabetic neuropathy. If this goes on for a while, symptoms can worsen, potentially leading to severe burning and piercing pain. Neuropathy can also affect the circulatory system, causing heart rhythm disturbances, or impact the digestive system, resulting in constipation, diarrhea, or difficulty with bowel movements. In some cases, bladder problems can occur, where the bladder doesn't signal the need to urinate even when it's full, increasing the risk of infection. Another serious complication is diabetic foot, an ulceration on the sole of the foot that can be symptom-free at first, progressing to tissue necrosis and ultimately sometimes requiring amputation. Moreover, high blood sugar interferes with kidney function, reducing glomerular filtration and leading to chronic kidney failure. As a result, people with diabetes are more prone to high blood pressure and edema. Hyperglycemia also affects the cardiovascular system, increasing the likelihood of heart attack or stroke. In the mouth, it can lead to gum inflammation, periodontitis, and tooth decay. Sometimes ketoacidosis can develop, triggered by a lack of insulin and very high blood sugar. In this condition, the body can't utilize glucose and starts breaking down fats, producing ketones. A rapid increase in these ketones causes the blood to become acidic. This is often accompanied by a distinct acetone-like odor on the breath, similar to nail polish remover, and can precede loss of consciousness and hyperglycemic coma. It most commonly affects people with type 2 diabetes. As you can see, excess glucose in the bloodstream is harmful for many reasons. It's important to know what normal blood sugar levels are. There are also groups at higher risk for diabetes. Those who are overweight or obese, lead sedentary lifestyles, or have a family history of the disease. People with high blood pressure, elevated triglycerides, polycystic ovary syndrome, PCOS, as well as smokers and those who consume too much alcohol, are also at risk. A diet high in simple sugars can be another factor accelerating the development of the disease. I hope this overview of symptoms shows you that seemingly minor complaints can be a sign of bigger issues. Again, I'd like to reference an old but very fitting saying by Hippocrates: "It is better to prevent than to cure." Most of us would rather avoid medication, but that means adopting a preventive approach, which includes a proper diet, physical activity, the right supplements, and mindful observation of our bodies, without veering into hypochondria. In the video description, I've provided a set of supplements that can support us on our path to better health. I strongly encourage you to leave your thoughts in the comments. Thank you for your attention, and I look forward to seeing you in the next episode. Take care.